2022, it's almost at an end, and what a year it has been. I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center for Skin, ENT and Plastic Surgery, Bangalore. And today, I'm going to take us through a look back at the year that just went by. What all we did in the Venkat Center, the journey that we were on, and what we will be looking forward to in the future. Now, 2022 was a very interesting year. It was probably the first year where we had some semblance that the COVID pandemic might be coming to an end. Things slowly started getting back to normal. We did not have a major disruption in terms of a lockdown or anything like we had in the past 2 years. And that was a welcome change. With this, there was an increase in people wanting to get back to their daily lives. And that meant that people were also looking to get their procedures done that they had been putting off because of the COVID pandemic. So this year, we saw all those patients who wanted hair transplantation, who wanted liposuction, but were waiting for the COVID pandemic to get over, and they were able to do their procedures safely without any stress. Along with our usual facilities, there were several new things that we introduced at the Venkat Center this year, which we highlighted on our YouTube channel as well. First of this was early in January, we introduced Chrysalix, which is a 3D modeling system that helps patients see what the result of their surgery could look like. It also helps us create a 3D model and help identify the issues in the patient that could be made better. This is also very, very useful for video consultations. People sitting somewhere else, the quality of a video call might not be very good. But with the Chrysalix 3D model, I could see their 3D sitting here far away from them and see exactly what it is that they were trying to express. Then later on, towards the middle of the year, we introduced a revolutionary new treatment called migraine surgery. As far as we know, we're one of the first centers in India to introduce this. Now, when you think of migraine surgery, you might be thinking of some kind of advanced brain surgery. But that's not the case. I'm a plastic surgeon. I don't do brain surgery. The concept of migraine surgery was first founded by a plastic surgeon who saw that when he did facelifts on the face, the patient's migraines often improved. When he did further research, he found that there were trigger nerves in the face. They can be above the eye, they can be on the side of the head, they can be in the back of the head. When these trigger nerves get irritated, that's what triggers a migraine. So, with this procedure, you make a small incision under local anesthesia and you just release the trigger nerve from whatever is constricting it and making it tight. And with this, the patient's migraines are greatly improved. We're not curing the migraine, but we're reducing the trigger for the migraine. It's important to choose the right patient for this. In 90% of properly selected patients, there has been an improvement in their migraines post-surgery. And we are happy and excited to be one of the first in India to introduce this. Thirdly, just a few months ago, we introduced the Piezotome, which is a wonderful new machine to help in rhinoplasty. It is basically a fine machine that just makes small cuts in the bone and helps to improve the way surgery is done. You can do very, very fine work with this. So this has helped us improve our rhinoplasty results. Now, don't take my word for it. Enough about me talking. Let us look at some of our wonderful patients this year and what all the procedures we were able to do. We were blessed to be able to do a wide variety of work from the head all the way to the toe. We did blepharoplasties, we did rhinoplasties, we did gynecomastias, liposuctions, hair transplants, abdominoplasties. This is just a small sample of the work that we were able to do this year. And here is a brief snapshot looking at some of the results that we were able to give our patients. Now, photos are all well and fine, but what do the patients themselves feel? Let us hear from them. Here is a collage of some of our patients talking about the experiences that they had at the Venkat Center.
I'm feeling really happy.
I found this clinic is very, the review and all and the comment are all very good. So that's why.
Fantastic.
He properly explained me everything and I'm happy with the
So
result.
I'm happy with the result what I've got from what I was to what I'm now. So I'm really happy.
How was the procedure?
Very simple. Just within 40 minutes, I got my procedure done.
With many from many people, many reviews, I opted this.
Sure. Now, a big part of the Venkat Center is academics. We believe in using our expertise to help advance the field that we practice in. And this consists of three main areas. One is publication, researching and presenting our research. Second is talking at conferences, giving our expertise to other people, other doctors, and helping improve the standard, as well as learning from other doctors so that we can give better results to our patients. And thirdly, organizing teaching programs. So on the publication front, we did several important research studies this year. We had a couple of important research articles in hair transplant in the beginning of the year, and we had a very landmark paper on the modification of torque and RPM for hair transplant come out just a few months ago. There was a very important paper that I published with Dr. Bill Adams from the USA, which speaks about how to reduce capsular contracture in breast implants, and this is again a landmark paper. Please stay tuned, there will be a podcast on this coming up soon. And on the conference front, we were able to present our research at various conferences. I was invited to speak at Istanbul, I was invited to speak at Bangkok, as well as Amritsar, Goa, Hyderabad, to name a few. And we are blessed that we were able to share our expertise as well as learn from several other fantastic people doing great work all over the world. On the teaching front, we had a Venkat Summit in the month of July, which was a one-day event in Bangalore wherein we had dermatologists from all over the country come and attend to learn the nuances of aesthetics. We've been having our weekly teaching program, which is broadcast all over India and which is attended by a lot of residents from all over India. And just last week, we had a hair transplant workshop where again people came to our center to learn our technique of hair transplantation. Here again are a few small snapshots of these events. Now, on the social media front, our YouTube channel experienced excellent growth. We're almost at 8,000 subscribers right now. To be honest, when we just started the channel, we just wanted to showcase our work and help patients get more information so that they could take informed decisions. But as we went along, we realized that there are more important things that we could be doing. We saw that there's a lot of misinformation happening. People are getting false information and they did not know where to get real information. And we took that as our main aim to help improve and help patients get the best information they could before they take their medical decision. There were a couple of big events this year that caused a lot of controversy. There was a death in a hair transplant patient which happened in Delhi, following which the National Medical Council issued guidelines on who should do hair transplantation. They ruled that only dermatologists and plastic surgeons are trained to do this procedure. Unfortunately, cosmetic surgery is a field which is rife with quacks. There are lots of people without proper training attempting to do these procedures, and that can be detrimental to their patients. Remember, a surgery is a surgery. A medical procedure is a medical procedure. It's not something to be taken lightly. You need to do your research and make sure that you choose the right provider for your needs. And that is our aim. Our motto is expertise, experience, ethics. We want to give our patients the best information and empower them to take the right call about their health. And on this journey, we are very thankful to have your support. It has been gratifying to see our subscriber base increasing and our videos increasing. The most satisfying thing is our patients who come to a clinic and say, we saw your video and that's what helped us decide. And that is a very, very gratifying feeling. So I want to thank you for that. Now, looking forward at 2023, what does the new year hold in store? Well, we will keep innovating, we will keep improving. We are currently in the process of construction of a new facility, and hopefully we should be moving there next year. We will keep you updated on that. As always, we will always look to improve our services and help our patients be the best that they can be. So that brings us to the end of this year in review. I want to thank you for your support and joining us on this journey. I hope that you will stay with us, that you will like our videos, subscribe to our channel and share them. Thank you for all your support. Looking forward to your support going forward as well. Thank you.